Martha?
Hey, how are you?
I'm fine. Hi, Sue. Hi, Jennifer.
Hello, how are you?
Doing fine. Hi, Cheryl.
Hey there.
Hey, Sue, congratulations.
Hey, thanks, Cheryl. I appreciate that.
Yeah.
Looking forward to it.
Hello. Yeah, I just called to tell you I was back in Gooch and I'm getting on Zoom meeting for several hours. Okay, I'll call you when I'm done. Bye.
Hi, everyone.
Hi.
Lisa,
Yes.
how are we doing? Who are we missing?
Well, we're missing a lot of people. And we've only got, so we got two more that just came on. Let's see, Mary.
Of the quorum, who are we missing?
Yeah.
Martha, was Krista planning on coming?
She is. She is. Someone just came into her office with a question, but I think she'll be on shortly.
Okay. And Lisa,
Tomorrow has-
Aaron's coming, right?
Not till 3:30, but yes.
Oh, that's right. And Suzanne is coming, right?
As far as I know, nobody has said they weren't coming except for Khaki.
Okay.
Right now, we have 2 for Charlottesville and 3 for Albemarle.
I.e. not a quorum for either.
Correct.
Okay. Well, I hope everyone's heard the great news that Sue Moffett is our new City of Charlottesville DSS Director. Yay, Sue.
Congratulations.
Thank you all. Thanks very much. Looking forward to it. Most days.
Katie, do you know if we're expecting someone from city schools?
I'm not sure. I can try to find out. I think it was going to be Beth Baptist, but I can't remember if she was gonna start this month or next month.
I sent the information to Patty Leslie,
Okay,
because that's who I had,
okay, I'll ask.
because I did not have a contact for Beth.
Lisa, do we have a quorum now that Krista's here?
We have 4. We're supposed to have 5. Charlottesville has 4, so they're good. Because they have an empty spot.
Oh,
Well, they don't have a parent rep and they don't have a provider rep. So they only need 4. We need 5. Now Tarn asked me about the survey, so I'm assuming he's coming.
I don't know. He's not a fan of Zoom. At least that's what he told me the other day.
Yeah, well, he didn't tell me when he emailed me he wasn't coming, but
Well, given we have a city quorum, why don't we go ahead and take care of city business? So if you all remember, we had talked about taking care of some time-sensitive business at the beginning, and then spending the rest of our time working on an updated work plan. So, oh, and there's Kevin. I mean, not Kevin, Suzanne. Now does the county have a quorum?
yes.
Awesome. That's okay. We're
That's
very
good.
happy to see you, Suzanne.
Oh, no, I was held up in a meeting. I'm sorry.
Nope, not a problem. All right, so I'll call the meeting to order. First item is the consent agenda, which includes the approval of April 2021 minutes and the April 2021 financial reports. So let's do the city first. Do I have a motion to approve the city's consent agenda?
So move.
I move that we approve the city's consent agenda.
I'll second that.
Who
Any,
seconded?
Sue Moffett
Thank
seconded.
you.
Any discussion? All right, all in favor, wave at me. Any opposed? Okay. And now for the county, a motion to approve the consent agenda.
I can make a motion to approve the consent agenda.
That was Lori, Lisa.
Yep.
Have a second?
And I'll second it.
That
Is
was
that
Suzanne. Mhm. Any discussion? All in favor? Any opposed? Great. All right, we do have one action item, approval of the FY22 CSA provider agreements, both licensed and non-licensed. Where'd Jennifer go? Oh, there's Jennifer. Jennifer, can I turn this over to you and Katie?
Sure. So I don't know if everybody had a chance to look at the email that Katie sent out earlier this morning. But we were finally at the very last minute here able to get these approved through the city and county attorney. So I don't, if folks have any questions about it, we're happy to answer any questions.
Do you want to go ahead and speak to just the additions regarding the Family First funding?
Sure. So that it only affected the licensed agreement. So with the Family First Prevention money that's coming to DSS, the state wanted us to incorporate some of the requirements for the 3 evidence-based services that they're going to be allowed to pay for with 4E money. And so the requirements that went into the CSA contracts are the requirements for those 3 services. So we incorporated that into our agreement. That wouldn't go into the non-licensed because it wouldn't affect those providers. And then the only other change that Katie had mentioned was for us in the county, our risk manager had a couple of minor changes that he wanted made to the insurance part of both agreements. And so we included that language in ours.
And just to refresh our memory, the 3 services reimbursable under the Families First funding are.
So it's FFT, MST, it's functional family therapy, multi-systemic therapy, and parent-child interaction therapy. Is that right? Yeah. Okay, it's those 3.
If anybody has any questions about those, ask Nita. Just kidding. Just kidding, Nita. All right, well, before we take a vote, does anyone have any questions about either agreement for either the city or the county? All right, well, let's go ahead and approve it first for the city. So I need a motion to approve the FY22 licensed and non-licensed CSA provider agreements.
I move we approve the provider agreements for the upcoming fiscal year.
And a
I
second? Who seconded it? Nita. Nita seconded it. Any
Thank you.
discussion? Okay, all in favor? Any opposed? Great. All right, so for the county, do I have a motion to approve the FY22 licensed and non-licensed CSA provider agreement?
I move to approve.
That was Suzanne, Lisa.
Okay.
Second?
Second it.
That was Lori.
Okay.
Any discussion? And all in favor? Any opposed? Great. All right. So that takes care of our business. So we'll move on to our retreat. Lisa has traditionally not taken notes for our retreat. So Jennifer has graciously accepted being voluntold to take the notes. So I appreciate that, Jennifer. So what we thought we meaning the planning team, which included Khaki, me, and Katie and Jennifer, what we wanted to propose doing is first of all reviewing our existing work plan, and just to see what we'd like to carry over into a new work plan for 2021 to 2023. Does that sound like a good plan? All right, so I'm going to try my hand at sharing my screen so that we can review the work plan together. When I share my screen, I have a hard time seeing folks, and particularly don't know if anyone's raised their hand. So help me out if someone's trying to say something. So give me a minute here. All right, I'm hopeful that people can see that. Jennifer, can you let me know if you can see it?
Yes, we can see it.
Thanks, Jennifer. Okay, so I also thought we could also pat ourselves on the back for some of the things that we've completed. So how do I find my scroll bar? Oh, there we go. Okay, so if you recall, so just to backtrack, so the original version of this work plan was created during a retreat in 2015, which I believe was in April of 2015. And those of you who were there remember this is the retreat that Safara Baker facilitated for us. And then we updated it, as it says here, in May of 2019. So the first goal was to increase the engagement and capacity of the CPMT to lead an effective and responsive system to address the needs of children. And we had a number of strategies. And so one of the things we've completed is we revised the community practice model to reflect multicultural expectations, and we messaged that out to both case managers and providers. And we are still in process of providing resources and tools to providers and case managers. The second strategy was increase engagement with the judicial system. And this was around attending a court users meeting and inviting the judge to attend CPMT meeting. I don't recall that we ever, did we reach out to the judge? Martha, do you have any recollection of that?
I don't.
So it sounds like we might want to kind of hold that strategy, maybe and kind of to roll that over into the new plan. What do others think? Do you all think that's still relevant to invite the judge to attend a CPMT meeting?
He's been very involved in the Georgetown work that at the moment is just city focused, but of course that focus will broaden. You know, time-wise, I think it might be a challenge, but I wouldn't discourage us from doing it if people think it's appropriate.
Are court users meetings being held?
Not in the city.
Mary, do you know if court users meetings are being
I
held?
don't think there's been anything.
I don't think there's been one since the pandemic. They were having them before.
There were a couple of meetings with a more narrow scope about how to reopen court and court functioning during the pandemic. I can't remember exactly who all was included in those, but I think Mary's right that there aren't any, haven't been the traditional meetings probably since the beginning of that.
Well, perhaps we'd like to kind of hold on to this strategy for our next plan. Does that sound good with everyone?
I just had a question about what we hope to achieve with the judge being invited, and is there some sort of specific, is it just having the judge observe, or is there a specific topic that we want to engage the judge on? And I think it helps inform what kind of invitation is sent.
What I recall, it was sort of partly educational in terms of helping the judge understand more thoroughly, you know, what CSA can do and what CSA can't do. And then also to share kind of some of our practice model to, you know, to share our focus on family engagement. And it's really more just a dialogue so that the judge is clear of kind of what we'd like to see for children and families, and then also to hear back from the judge what you know the court's expectations are. that's what I recall. Does anybody else have anything to add? Does that make sense, Misty?
Yes, it does. Thank you.
Okay, the next strategy was orient CPMT members to local CSA system. And it was suggested that we attend FAPT and complete the online OCS tutorials. I'm not sure where we are in terms of each one of us attending FAPT and completing the OCS tutorials.
I didn't even know there were OCS tutorials, so thank you very much. I'm putting it down.
We recently added, since this, I think, goal was set, Taryn and Michelle Busby as reps on CPMT. I wonder if they've received like an orientation and if they have any feedback on how that's going.
I can say I was never trained. I just showed up to the first meeting and kind of jumped in where I could, but I wasn't really sure what was going on.
In regard to the OCS strategic plan, some of us have been working on, I get objectives or suggestions that hopefully would support new folks coming on. That was one of the things I actually gathered some information from one of the SLAT work groups in that area. So hopefully there'll be more focus on that from a state level that would be helpful to the localities.
I think it would be great. I think it would really help newcomers to just, even the tutorials or any of that would be great. I just didn't even know about it, so.
I remember, I think it was myself and Aaron that had attended a FAPT meeting when we set this goal. So I know some of us did attend FAPT after we did that.
And if you want to remember, the feedback we got from CPMT team members who did attend said it was really helpful in understanding the process.
And it was also as a result of to not invite individual like families to come to present to CPMT, is for us to go there rather than them come to us. And so we decided to switch that and not invite them to our CPMT meeting to present, but to go where they already were.
That's really good to reminder. That's a good reminder. That's exactly right.
So
Well, perhaps one of the strategies that we can include in our next work plan is to sort of establish like an orientation process. And I'm hopeful that maybe our CSA coordinators could help with that, because I know our CSA coordinators do an orientation with new case managers, right? Don't you all
Yes,
do that?
this is Cheryl Duggan. We also have an onboarding process for FAPT. So when new members come on, particularly, parent reps or when the new private provider reps come on, there's a process in terms of meeting with them and a notebook of materials and things like that that we've got set up.
It sounds like we need to do a similar thing for CPMT members.
I think it may be worth just sort of having a more formal process. I mean, I've reached out to Taryn and Michelle with offers to, meet with them. And I want to say, I'm pretty sure we met with Taryn. And then Michelle had said, because she was already sort of experienced with CPMT from being on it in the city, she wasn't really sort of feeling like she needed that. So we did not do that with her.
And I honestly, from my perspective, I think what happened with me is people just assumed that Tim and Kevin were filling me in on all the necessary things. So I just had to search them out a little more, but that's probably why it wasn't done with me.
Yeah, maybe it would be helpful to kind of have a checklist for folks so that everybody is kind of getting the same orientation too.
Well, I wonder if we can piggyback on the FAPT onboarding, take a look at what you all do for the FAPT and then see what's relevant for CPMT and then what we would add. So this is timely because while Sue's been around a long time, isn't this the first time you've been on CPMT?
Yeah, that's exactly what I was thinking. I've been exposed to a lot of this, but have never been on CPMT. So I would find that really helpful.
And then you'll have the new Albemarle DSS director person. So I think this is timely. All right. Ready to move on? Hearing nothing, I'm going to move on. All right, so the second goal was to finalize outcome data to better understand, direct, and recommend policies and practices for children receiving CSA services. And so first strategy was to implement the CQI tool, and we did that. And then to analyze data on a regular cycle. And so when I reviewed the survey results, it sounds like data collection is a common theme. So why don't we table the discussion about this goal and until we get to the survey results to see how we want to tweak a new goal, taking into account the survey results around using data and data collection. Does that sound okay?
Yes.
And then finally, I think this is, well, the third goal was increase the visibility of the CPMT and gain support for its mission at the local, regional, and state levels. So I know that both city and county presented to the city council and board of supervisors respectively. I know I presented in the spring. We deliberately didn't tie it to the budget cycle. So I think I presented in the fall of 2019. Sue, do you remember when it would have been Diane and somebody from the schools, I think, presented to the city council?
I know Diane did, because I remember the city council meeting went way into midnight hours because it was when city council was addressing the monument situation. And so Diane ended up telling me to leave the meeting, but I know Diane did present to city council, but it would have been when all of that was going on.
Yeah, you're right, Katie. It would have been in the fall of 2017 because you and I were both with her. And when we got shifted on the agenda, then she dismissed us kindly and she stayed until close to midnight and presented, I think.
Yeah.
So I think it was probably like October of 17, something like that.
Gosh, maybe I did it in 2017. I didn't realize it was so long ago.
I think it's been a while.
And then I think we had a few other groups. We decided to kind of ask program to take the lead on, communicating with families and parents. And then OCS. I know over the last several years, we've advocated with OCS around specific issues. And Martha, you're on SLAT, right? Are you on SLAT?
Right. I'm about to roll off, I think. But yes, at the moment, I'm still on SLAT.
And I know I never went to the school board. City folks, did anyone go to the city school board?
So when you presented, Phyllis, it was a joint meeting between the supervisors and the school board. It was one of those meetings.
Right. That's because Kevin was with me.
Right, and Kevin presented with you.
Yeah.
Yeah.
Yeah, okay, thank you. It's so helpful to have someone to help me keep the hamster on the wheel there.
But I don't think there was ever a presentation to the city school board.
I'm sorry, what?
I don't think there was ever a presentation to the city school board, though.
I think you're right, Katie.
State legislators, SEC, and General Assembly. Not sure what what our plan was with that. I know that there was been a lot of advocacy from the league and also the CSB organization. What are folks' thoughts about all of these various groups? Is this still a relevant thing? Is this? It seems like in the last few years, all the focus has been more on the special education, you know, and at the state level with OCS, and there's hasn't been as much action about other aspects of CSA. I guess my thought is that I feel like we do a good job of when an issue comes up that we want to have an official communication come out of CPMT, we do that. And so I'm not sure about the relevance of kind of this being in this work plan in this way, but that's just my thought. I'd love to hear other people's feedback.
Yeah, I would agree with you, Phyllis. I think CPMT, as long as I've been on, has done a really good job of weighing in on things that CPMT believes that could have impact in a way to advocate. So I think we spread ourselves too thin if our goal is too broad in general, because really I do default to BACSB and DSS to the league, and they're moving in a direction, a direction that for us is step Virginia and not always applicable. So I don't know if it would be better to take it off or just limit it to that specific. CPMT will advocate on specific issues, or as they come up, list them so we can track them, something like that. But I think it's the way it's written. I don't know that anyone has the capacity to, be known, heard, have a relationship with those legislators in this way.
What about just summarizing it to say legislative advocacy, and then it would be through whatever conduit was appropriate for whatever issue was presenting? Might be the local legislative packet, it could be the league, it could be General Assembly, state legislature, whichever.
Seems like a good suggestion.
So what I was going to suggest is that, I'm taking notes and Jennifer's taking notes, and the planning team can draft, kind of a new work plan. And so why don't we'll take this and draft a goal around legislative advocacy. I like the way you characterize that, Sue. Does that sound okay? And because I agree with Nita, this seems too broad, but more just kind of being more laser focused on advocating for certain situations or policies that might come up that we have concerns about or we want to support. Sound like a plan? Then the last goal was ensure the local CSA structure is effective at utilizing all available resources to meet the goals and requirements of the local CSA program. And this goal was really a lot about strengthening the kind of the feedback loop within the system, meaning CPMT program and case managers. So I'm not sure that we held to this. I'm looking at strategy 4.2 because it occurs to me that the program chair has been coming every month as opposed to just coming once a quarter and offering specific feedback on these areas.
Yeah, the program has met monthly, and I know somebody from the program comes and delivers information. It's not a quarterly.
I think when we started this, we said like program would meet at a minimum quarterly, and then program has felt like they've needed to meet monthly. So I think that's kind of what has now.
Oh, this was program meeting quarterly.
Yeah.
Oh, okay. Sorry about that. Okay. And Krista, you guys are talking about family engagement, service gaps and recommendations, et cetera, right?
Right. We are, we're actually talking about that most of every meeting. So I don't know if we still want to keep it divided up by quarters or just make sure that's incorporated. Either way, I don't know if Katie or Jennifer has any input on that or why it was put that way, but I think we cover everything that's really needed to be covered each meeting.
I think we set it up this way because program was really wanting some direction from CPMT and some areas of focus at the time.
Yes.
And so that's what I remember is this was CPMT giving program kind of some focal points and making sure that those are at least being touched on or discussed quarterly.
Yeah,
Yeah.
good recollection, Katie.
Right.
And so I don't know if we still feel like that's necessary. I think it is difficult for program to kind of stick to this quarterly schedule because, you know, we are talking about most of these at most meetings or as things come up. So.
Well, it sounds like program is functioning and you know, feeling comfortable about how they're proceeding. And to strategy 4.3, you guys have been working on the survey to gather feedback from case managers and families, right? Oops,
Oh, we have, yes.
Yeah.
Have we gathered, I'm trying to think, we did gather feedback from case managers. That's right.
And in terms of 4.3.3, I think the cost containment work group sort of exhausted what it could do, short of capping rates, you know, and there was just a lot of concern about doing that. All right, so it sounds like some of the things that we want to carry over is a new goal around engagement with the judge, an orientation process for new CPMT members, and a goal around legislative advocacy and make it more specific or targeted.
And then data collection and how that is analyzed and
Yeah,
used.
and that that was a theme in the survey. So I think hopefully we'll be able to create a whole new goal around that. Taking into account the feedback from the survey. All right, any other comments around our current work plan or anything that you think that I've missed about wanting to carry over? I'm gonna stop sharing so I can see you guys. But we're all good there? Okay. Does anybody need a break? Nita needs a break?
I'm just gonna go to the bathroom, but y'all don't have to break on my account. I'll be right back.
Let's take a 5-minute break. I've got to pull up the survey anyway. All right, so we'll be back here at 1:45. All right, most of us are back. So what I thought we could do is I can screen share again and just go through the survey results. Thank you all for providing your input. And I'm hopeful that we'll just have a discussion about, what catches our attention, how does this inform where we'd like to go from here? Just really make this a more organic process. So let me go ahead and share my screen and we'll go through it. But you all also have it, right? Lisa sent it out yesterday. So, and she sent the raw results and then also kind of an analysis. And so what I thought I would do is share the analysis document. All right, Jennifer, can you let me know if you see this?
Yes.
Great, thank you. Okay. So here's where I got the idea about that we'll be talking about data collection. So what Tamara was indicating is that the main emerging theme is data practices. Okay, so the first question, what is CPMT's role to coordinating bodies? And it sounds like, it looks like the two top ones were sharing data for local and regional policy or practice change and advocating for local and regional policy or practice change. So here's where the idea for data collection practices comes out too. What do you believe CPMT members do well? 80% believe that we work well on behalf of both localities. And then some of the others were improving services, sharing information, and respecting members. And then in what areas can CPMT be more effective and overwhelming? Greater analysis and use of data. And then a second was making data more accessible. So again, it looks like data practices is going to be a key topic of discussion. And then some of the others were increasing the engagement of parent and succession. And then what areas should CPMT focus on? Long-term planning for needed services. And then again, here's another one for data and quality assurance procedures. And what deficiencies for CPMT should be addressed? And again, making data accessible to others. That was a big winner. And designated staff time for data collection. And what future trends and issues are of importance to the CPMT? This was a common one: racial disparity among children in foster care. And then annual service gap analysis, getting feedback from families, and looking at services regarding trauma and substance abuse. What is your vision of success for the CPMT? Be more strategic and be more intentional in data collection and analysis. What is CPMT's role to coordinating bodies? Here's another one on data, sharing data for local and regional policy or practice change, and then advocating for those changes. And then no additional comments. So again, data is a common theme. And so if you recall from our previous work plan, that was also, the data collection was also included in that, but that focused more on using the CQI tool that was developed by OCS. So again, I'd like to just open this up. Given the feedback from the survey and given our fits and starts over the last several years with trying to present data and look at that and see how that can inform our work. What are some initial thoughts?
I can jump in. Thank you. I think, first of all, I want to say that this survey was really good, and I appreciate the planning team putting it out there for us. I think it really helps kickstart these kind of conversations in this virtual retreat setting. So thank you so much. The thing that comes to mind for me is that, and I don't know how we want to do it or not, but the good data is first you're collecting the right thing and it's reliable and all that, and then you look at trends, and then you look at possible comparisons, and those types of things. And then I think the last piece that I think would be neat if we could do it is if we see a trend, if we see something, and I know we talked about them, you're like, hey, I don't like what I'm seeing there, that's still the same, but I feel like where we could take it further is that then we say, let's set a goal on this one thing. So you focus, and not to do everything in the world, but we could say there's one trend that we see or one specific area, and that we look at it maybe as a team, but also look at it, how can we reach out to others to solve it? Because it might be some trend or some situation that this team sees that is larger than us, right? That might take other entities, other groups, and maybe that would be something that we can actually start sharing out more broadly with others, that we're seeing these 2 or 3 trends that or data that we don't like. How can we as a collective community in a broader way, lean in and help do this, and how could others help it? So that's my initial thoughts. Thank you.
Thanks, Lori.
I have similar thoughts to Lori about the data. I thought that when we went over the CQI tool at one of our meetings, that was probably one of the more engaging conversations because people were able to look at data side by side between Charlottesville and Albemarle. And that's where I feel like a lot of folks in this room were expressing some curiosity, or did you see what I just saw? And I wonder why that is. And I think that when we get curious about things, that's when we get to use our collective brains and think through some things. And so when I think about like one of the more meaningful and productive meetings that the CPMT has had, that's the one that comes to mind, is because I'm like, oh, okay, I didn't realize that before. Why was that? And then I think the other thing that the CQI tool did was you could look at trends like, oh, wait, let's go back and see what we did in 2019 and then now. And so it was just something that we could do in real time that was engaging in real time. And we were able to express curiosity and ask questions. But to Lori's point, we asked those questions, but then I don't know what happened to what was the takeaway and like what happened after we were curious. And I can make some assumptions about how we might have taken those back to our individual agencies and thought about it and share what we observed. but I think taking it to the next step of being able to like following up at the next meeting or coming up with a strategy.
I totally agree with what Lori and Misty are saying and would add. So yeah, we see things that concern us or like, oh, let's look into it. It's also, so for me, somehow it's embedding in CPMT meeting a period where you actually can think out loud. Maybe it's time limited, but when I'm in CPMT, like I'm not a very good auditory learner. I kind of have to engage in conversation. And for the things that we do in CPMT, that's fine. Like I don't like, gosh, I need to talk about it. But I think if like we're talking about data that we want to change in some way, I have to have time to like engage in that, like bounce it, like, am I off? Is this something we have control over? That kind of conversation. And I think we've struggled with this. And again, I've been off CPMT and then back on, but during some of my stints, we've struggled with it. And then we've tried to make a data committee to do that. And the time is just not really available for us to have subcommittees. I mean, I felt so bad. Kevin tried a bunch of times, Khaki tried a bunch, and it just, I think that was its purpose, is to really take the data and have that brainstorming kind of conversation. And I just don't think that CPMT members really have that time capacity. And so is there a way to embed that? Like, okay, 20 minutes, you know, here it is. Let's brainstorm and end with next steps or something like that, so that there is others maybe feel differently. And so I would defer to what's best for the group. But for some of you who know me, it really is like, I have to conversate about it, or I just don't get it. It's a brain limitation.
Well, I think that speaks to what Misty was sharing about the time we did review the CQI. That was one of the more engaging meetings because we were looking at it and had ideas and, things occurred to us.
I also think it does it meets like two goals at the same time when you look at data. And if one of the charges or one of the things that CPMT should be focusing on from the survey is looking at racial disparity. I remember that was, a lot of what the CQI was showing us. So not only are we looking at data and brainstorming solutions, but we're also addressing the racial disparity by having real-time discussions about what we're seeing. And I also think that I can't quite remember if the CQI tool talked about like services being utilized and who's using the services. But as far as like the needs gap survey that we do every year, it'd be really easy if that was like on the forefront of the brain. And then that way we could say, rather than anecdotally, what we feel like are the needs, we would be able to see those needs reflected in the data.
Would it be helpful to take a look at the CQI tool to remind ourselves what data elements are gathered in that tool? Because frankly, I'm not remembering them right now. Because I guess I wonder if it would be helpful to look
I
at
think it would
that
be helpful.
and then figure, how do I find it, Jennifer? Do I just, I guess I still have Khaki's presentation. Would that be the best way to do this?
Probably.
I thought that there was like live action button pushing that was happening. I feel like it was like.
So yeah, so part of it is OCS has some resources online that, and that's part of what we used to get some of the data that went into the CQI tool, but the tool itself is not that. But we were using the data from what OCS provides to inform what we put in the CQI.
I think where I was going with this was to see if what those data elements were sufficed, or whether there are also other things that we wanted to see if we could collect and have conversations about, or whether we just want to start with that. I just can't remember all of what we.
I just emailed it to you.
Thank you. This is the data, and then what Kathy did was she presented the data on these data points. I can't see, so I don't.
Right. So we got the data from the OCS from that dashboard, and then we used it to fill out this template.
Got it. So what data points do you all think of this table would be ones that we'd want to kind of maybe, I'm thinking out loud, like have kind of an ongoing look at what the data looks like. I don't know whether it's possible to do it monthly or quarterly, to have these conversations. So let me just scroll down real quick so you can see it.
And I was thinking, I think the conversations are good, Phyllis, but I also think like the action around it. So it's not really seeing, I mean, I feel like when we see the data, we get curious about it. We say, this is one that's we really want to change or work on, and then go after it. But I mean, I think it's fun to continue to be curious about it. But I do think that the point I was thinking about is that the action item, and then using that data to like turn it to an action, and then watch the data after we've done strategies. Maybe that's too specific.
No,
I think that's, I think that's really a helpful way of looking at it, because I feel like that's what we've lost a little bit, and the pandemic's probably not helped that at all. But at one point, if you can think back to the commission days or maybe earlier, we weren't just looking at the data. There was a plan around that for moving forward. And I feel like that's where we're kind of stuck right now. And we certainly want to be looking at how children of color are being impacted, and how many are being served, and what those outcomes are, and what systems they're bumping into, how dollars are being spent there.
So I'm new to this, so I'm sorry if it's already there, if it's been discussed before, but it seems like a lot of this stuff is already included in those monthly financial reports. And I wonder if we could just see them as part of a trend instead of a monthly snapshot, even just quarterly or something. It might help us identify things that we need to get better at, or that are going really well.
Does everyone have a sense of what's on this tool? Can I stop sharing?
Yeah.
I very much agree with Lori that it would be good to have an action item come out of the conversation. I guess what I'm asking about is, how do we want to structure a process by which we present data, have the conversation like Misty and Nita were describing, and then coming up with a action item around that, coming out of that conversation. It seems like that would be an appropriate goal for us in our next work plan to really outline kind of how are we going to do this? So, the goal could be, using data, allowing the data analysis to result in an action plan or something like that. And then the strategies would be reviewing data on a monthly or quarterly basis. But I would suggest specific data elements, not just reviewing data, but really think about what is it that we want to hone in on and look at, and then a strategy of, okay, what action do we want to take from whatever we're observing or find noteworthy.
I think one thing that's held us back before is we want to see everything. I feel like there are a lot of different data points that we want to look at, and I agree, picking a couple and really focusing on those and having conversation around those, I think will help focus the conversation and help us identify some action steps. Not that the big picture stuff is not relevant or helpful, but I do think it's hard because there's so many things we want to look at. So that might be helpful, I think.
So
The goal-
one of the feedback from areas of feedback from the survey was racial disparity for children in foster care. But what about if we expanded that to look at racial disparity of children served by the CSA system? So we'd be looking at racial disparity in special ed, racial disparity in foster care, racial disparity in juveniles on probation, and that could be really something we really hone in on. And maybe CPS investigations.
I like that approach, Phyllis. And
I do
again,
too.
I think a lot of this is larger than us, right? So it's almost putting our voice and our energy in with broader groups and communities, right, on that are working on those types of things. So sharing our data with others who may be working on the same types of things and saying, we're seeing it here too, or here's a strategy. And we can use it as a connector, I guess, to others.
Well, and it's a way to prevent all of us from recreating the same wheel, because we can share information and let each other know what's worked for us and what hasn't. I think that's a great idea.
One of the goals could be, selecting a structure to have these conversations, and having some folks, weigh in on how that conversation is structured. But I'm also for not reinventing the wheel, and that tool, the CQI template that's used, has those columns of what are you observing, what's the takeaway, what's your goal around that, or your action item, and who's assigned to it. And I mean, you just
and we
use
can
that.
add to that tool. It has certain items that are prescribed, but we can add our own.
Right, and you can just delete the data points that is already entered in there that we have to report out on, and make it more specialized to this, our shared data, and what we want to look at. But just using the headers, and then we make our own.
I'm going to go, I digress for a minute. One of the things I love about these Zoom meetings is seeing everyone's cats and dogs, little kids. That's a pretty cat.
I'm sorry about that.
No, I love it. So is the data around the racial representation, if you will, of children served by the CSA system, is that readily available? I mean, I think it is for kids in foster care. How about special ed and juvenile probation and,
I think there's a way to do that. It's just a matter of figuring it out.
We just have to be really clear what exactly we're looking at, because we certainly have the data, but it's what part of the data do you want, if that makes sense? Like we have kids who are not making the grade clearly, and what proportion of students is that? We also have kids who are not excelling the way they should into advanced classes. So we need to, so there are lots of different avenues. So we just need to make sure we're pinpointing. So we're comparing and looking at the same thing. That's all.
well, if we target kids served in the CSA system for special ed, it would be kids in private day, right, and residential. Now, would this kind of data be accessible through the OCS site as well? Or would we have to go to our internal system?
I believe we can do it through what they have. I'm not sure it will. I don't know how up to date they update it. It may be like a quarter behind or so. But yeah, I think we could do it that way.
And break it out by mandate type?
I believe you can, but I don't want to say 100% because I haven't gone in there to try to do that kind of breakdown.
What other data elements seem critical or relevant? We've talked about racial representation and kids served by CSA. What other data, when we have had discussions before? Well, Mr. You mentioned differences between the city and the county.
When you put the khakis or the notes back up, I noticed that one of the things was that the difference in cost, the costs in Albemarle were higher than Charlottesville and the state, and then the Charlottesville's costs were lower than the state. And to be honest, I'm not really sure if I fully understand that, but like being somewhat new to CPMT, I guess I can't say that anymore, but I'd like to keep saying that. But anyway, it would be great to be able to like understand what does that mean for people, because people were like very curious about that. And I'd like to be a little bit more up to speed on why that's curious for folks and like what are the strategies that impact that. Or so
Well,
the cost was one that I think people were talking about.
And I'm reminded about what Sue was suggesting is instead of looking at our financial reports kind of as a point in time, present the data in a more trend way and then compare city and county. So for example, in March, we'd look at, okay, we had this much money for under this match rate, this many kids in this category. Okay, how did that compare to February, or how did that compare to last March, and how did that compare between city and county? Somehow maybe taking a look at presenting that information in a different way.
So, Phyllis, if I could take us back for a second, and maybe I missed something, but I feel like in terms of the racial disparity issues, and we're talking about kids served by CSA, but what would be really more helpful as an interagency body is if we could look broader than just kids getting dollars, if we could look at that for all of our systems. And maybe that's not this body's goal. I wish it was. And if it's not, I think we need to, as two communities working together, we need to figure out another way to do that.
Well, I think it's our choice if we want to make that our goal, right?
Right. Because I have, I'm serving lots of kids who aren't, well, not the numbers we used to, but kids who aren't tapping CSA money because they might be using money through our continuum or through the crime control plans. But, you know, are we treating all those kids fairly and equitably? I don't know. That's what we need to figure out, what we're trying to figure out. So.
I think I was also kind of thinking about it as how do we start, you know, instead of just starting with a too big of a picture, but can we kind of start small
Right.
and work out a process and then figure out how to expand that. That's kind of what I was thinking.
I feel like I'm hearing two themes. One is on racial disparity in general, and the other one is on finances. So it seems like if we don't, you know, so that we don't overextend all of ourselves with all the other work going on, that we maybe focus on those two topics as at least topical. And then we have to bite those down, you know, small enough that we can manage the work and manage the conversations and manage, you know, setting the strategy or goal.
I don't know if this is related to, I think, you know, it is related to financial, but just to throw in another data point is maybe like numbers of children served. I mean, I guess that gets to we have to look at that in order to get the demographics of those children. But just being able to pay attention to trends, especially with COVID and, you know, the theory that, you know, more kids are going to be coming into child welfare, it would be great to be able to track if there are spikes or not, or certain months or certain things, if they're connected, to be able to look at trends in or upticks or downward turns in referrals.
Well, if we take the financial report and turn that into kind of a more trend representation, that would
be there. Yep.
Because there's numbers and there's cost per child. I could pull it up.
Yep, you're right.
I would also want to know the percentage of the entire student community. So like Charlottesville City serves so many kids and Albemarle County serves so many. And what percentage of those kids are in CSA? Because it could look like the county has so many more kids going, but percentage wise, it's actually equivalent to what the city's doing because they have fewer children. Does that make sense? So I'd want to make sure that we're not comparing two things without looking and making sure what we're looking at percentage wise. Does that?
Well, that's how you look at the racial disparity data, because you compare it to the population.
Right.
You know, like in Albemarle, we have more Caucasian kids in foster care, but the percentages do not mirror the population.
Right.
I guess what I'm thinking is when we do RAP services through the city, through the county, not just private day placements, but when we're doing RAP services, which are and things like that, I think it just changes. I just think it would be interesting to see, and I guess it's in the data you're saying already, so we don't need to do anything else. Okay.
Well, hold on. Let me go get a annual report. And I don't mean annual report, I mean financial report. Okay, so if we change the way we report this, we would get cost in the different categories. We could the percentage in the different match rates, number of unduplicated youth, the service type, cost per case, and the effective match rate, and the cost per mandate type. So if we simply, looked at how do we want to portray this report in a different way that allows us to look at trends and really looking at differences between the city and the county, we could start there. But that doesn't give you the total number, Suzanne. I mean, the total number of kids served, not, it just, these are the kids receiving services paid for out of CSA. I'll be glad to get back to in-person meetings. Well, how's this for a place to start? Maybe since both DSSs are the ones that create these reports, maybe Sue and I can work with our respective peoples to look at how we can present this information in a different way that allows for looking at trends and differences, and then have as a standing agenda item, not just approving these reports and the consent agenda, but putting it elsewhere in the agenda, which allows time for a conversation of, oh, well, this is interesting. And then somehow doing the same similar thing around the racial disparity and figuring out how we can gather that data and present it in a meaningful way on a regular cycle of some sort. And we can start there, and that can be our, and we got to have it. And the part of the discussion is an action item. And for the next year, that could be a goal, and to kind of reassess at the end. Okay, where are we? Do we need to tweak that? What do we want to add, take away? So Jennifer and Katie, could I rely on you all to help try to figure out how to gather the racial disparity data and figure out how to present that on a regular basis?
Yeah, I mean, I think we can take a look at the data that's available in OCS and see if there's a way to get it to what we want it to be able to bring the CPMT.
Yeah, and I mean, that would, obviously only include kids that are being currently served through CSA. So, earlier we were talking about, do we want to broaden it beyond that? We would need to rely on community partners to bring that if that's what you all want to see. But we could work on trying to figure out what we can get through the state data system.
Yeah, I mean, my view was ideally at some point we would broaden it. I was just trying to find a way to have a place to launch.
Yeah, we can work on that.
So any other thoughts about, working on a data collection or practices, or is that a good place to start?
I think that's a good place to start. And there's already lots of little sub numbers that go along with that we've talked about. So
I agree. Those are important topics. And I feel like if we keep talking about it, we'll get too broad.
Is there any other goal that you'd like, that you have an idea about including in a work plan for the next 2 years? Anything jump out at you from the survey results?
One thing that I shared in the survey results, and it popped up again when we talked about, when you pulled up the CQI tool, it's talking about representation on CPMT program and FAPT. We have some racial and gender lack of diversity, and needs to be addressed. And you know, I was just thinking about the vacancies on the city CPMT. That certainly, you know, kind of falls sort of like the goal 4, I think, on the current work plan, as far as like system engagement, and being intentional about representation on these teams and making sure that those positions are filled. I know that that's been a challenge, but I think if we put some effort and intentionality into it, maybe we can progress a little bit. But I do think that taking a look at what are the requirements for CPMT, FAPT, and program, and really putting some thought into how to intentionally recruit or engage the community and have this be a body that people want to join and know about. So it could be a broader community engagement strategy, it could be intentional recruitment, it could be that with the end goal of making sure that all of our positions are filled with a representative body, both racially and gender-wise.
I think that's a really good point. There are some limits because CPMT membership is driven by code. And so if the positions aren't filled with, if the positions aren't filled in a diverse way, then kind of stuck. But the ones that we have some wiggle room, it's good to have an intentionality there. So the city vacancies are the provider rep and the parent rep. Is that what you were referring to?
Yeah, and you know, we've struggled with that for a while. I think in the past we've tried to do some targeted recruitment, but I'd certainly be interested in revisiting that again to see if we can try to get those positions filled. You know, they're appointed through city council, so it's whoever applies. But if we're able to kind of get the word out in some way, like I'd certainly be interested in that.
One of the things that I thought about was the other goal around like doing presentations to city council. People watch those things. Did you know that? They really do. And, you know, if there was a presentation time for CPMT to do a presentation to council, that may be a good time to put an intentional ask out into the world about, you know, the vacancies, what the purpose of those positions are, and how, what's the, you know, value of having folks, just to let people know that those vacancies are out there. I know it's on the website, but just in other mediums, how can we put the word out there? So that was just a strategy that I thought about.
Yeah, or you know, what parent groups do we have that we're aware of within our own kind of agency? Like, are there advocacy groups at the schools or something where we could kind of put some more exposure out there?
Katie, has anybody ever talked to FAR to see if they might have somebody who's been through their internship or program or is currently in their program that might also meet these qualifications and want to serve on something like this?
Not that I know of. I mean, I don't even know what FAR is. And so I guess those are the kinds of groups that I'm talking about, you know, within CPMT. What connections do we have, or what other groups do we know about that we could kind of get the word out to? That would be great if we could have some conversation goal around that.
As far as the Public Housing Association of Residents, and I'll give you a call tomorrow about it, okay?
Okay.
No, we reached out to NAMI, right, Jennifer? Lisa from Region 10 connected us to somebody at NAMI and never really got any response.
Right, we tried several avenues with Kevin with the schools, doing some presentations to some of the parent groups. We went to community attention to reach out to some of the foster parents. So we definitely tried lots of things. And then it just so happened that Michelle applied, like we didn't even realize that it had happened until it was done. So it worked out for us. But we definitely had some targeted recruitment that we were trying to get in place to get to fill that position.
And even just speaking specifically for community attention and CAF, like there's a lot more, opportunities for parent engagement now that they've had to be creative and gone virtual. And so there's just lots of different places now where people are plugging in. And there's an organization that's been developing over the last couple of years is the Charlottesville Area Network dedicated to youth development. It's Candid. It's a network of all after-school providers. And so that may be a way to do a presentation there, not only for the parent piece, but for the provider piece. And so that's again, what Katie's saying is like all these organizations that we can leverage our relationships that we have out in the community to just sort of do some presenting or talking about those vacancies.
Thinking about, like, I don't know what, the city's social media presence is, or is there a way to get something out on social media?
Me and Lasheen.
Following that, how do we
She's
do
good.
that?
Yeah.
So.
So Misty, you also mentioned program and FAPT. How do the agencies determine who's our FAPT representative? I know historically ours was just a child welfare supervisor, right, Cheryl?
Yeah, I mean, because of the way we're structured, we do require, it has to be a supervisor or a senior level position because of the fact that we have our FAPT authorizing funding. So it's a little different in terms of just kind of across the board. But the agencies determine who they're going to send as representatives, and some agencies have 2 people who rotate as well.
So recently when Julia resigned to pursue her position at the state, we knew that we had a community attention supervisor or senior position available that we could offer a rotation, and we've added Raphael Holland, who's a supervisor, and so that added a different rotation. So, I mean, I just think it's about having a conversation amongst the FAP teams about, okay, who's been here? Are there other staff of color? Are there other supervisors of color that can add to the what we currently have? And so taking a turn to step out so that someone else can step in.
And then taking ownership in our own agency about, using that as that one criteria. Clearly we have to have a senior or supervisor person given our process and which was approved by the state, by OCS, but we can also think about other criteria.
And then it also points to a larger, more systemic issue is that if you're looking at your leadership teams in your own organizations and there's a lack of diversity there, then that's a whole other systemic issue that needs attention.
Right.
So it's all healthy conversations to be having all around. So.
So Misty was suggesting maybe that be an additional goal for our work plan, is kind of an intentional look at, just an ongoing intentional look at our representation on program FAP and CPMT. What do others think about that?
I like
that plan. Hopefully you guys can hear me. I'm in my car, but I think that sounds good.
And then maybe some of the strategies under there are targeted recruitment for positions like the parent rep and private provider, and the agencies give some thought to who they assign to FAFT or programs to enhance diversity. That sound good? Anything else that we want to add to our work plan?
I know you mentioned something about onboarding, and it seems like it would go hand in hand with new recruitment. So as we think about new recruitment, especially trying to become more diverse in many of our areas, maybe also, once we recruit, the training, the onboarding, that it's a bit systematic. Maybe a mentor that takes someone under their wing for a while to kind of say, hey, here's what we're working on, here's what this term means. Something like that might be a goal.
That's a good reminder. So we did want to add a goal about legislative advocacy. And so you're suggesting we insert the onboarding goal in this larger goal of representation on the 3 entities.
It seems connected.
Yeah, it does to me. What do others think about that? We had also talked about having a goal of engagement with the judicial system. So that gives us 1, 2, 3, 4, 5 goals. I don't think we want it too big. Does that sound like a good start?
Yes, I think that sounds great. I like the 5 goal limit too.
Well, so I'm willing, if I can get Jennifer's help with this, to flesh out these goals and put it in an action plan template and bring it back for our June meeting. And we can take a look at it and tweak it and hopefully kind of finalize it for fiscal year 22 and 23. Sound good?
Yes.
So the other item on our agenda was going down CSA memory lane, as requested by Lori. I'm happy to do that, but I need a break.
Yes.
So how about if we come back at 2:50? Is that good? Okay.
That's good. Thanks, Phyllis.
Mhm.
process.
There's not enough chocolate in the world.
No, I just wanna, like, stab my eyes.
At least we talked about an objective, like, let's
Yes.
just stop talking about the freaking data and not doing anything about it. We've been
Yeah.
so dysfunctional. I'm sorry, I'm like really not. We're shut down, I hope, for the moment. No, I don't want to say that. They can really have that moment. Oh, so, yeah. What you doing? So everybody accepted. Okay. So you're dysfunctional. I feel really good to have objectives. So we're kind of freezing up. I saw something.
Yeah, you have to freeze it, and so it usually helps to turn.
Yeah, you all. Tammy, are you listening? Tammy? I was saying to Krista, we need to make a hotel reservation for Bruce Hall.
Okay, do I have to find out which one is KJ acceptable or just comes out of the city?
Because I think we take it out of the city. It's a supervisor position. I don't think there's any problem taking it down to the city.
So he's the only one?
He's the only one at this point for once when I offered it to everybody and I've mentioned it more than once. So anyway.
Where would you like for me to look?
Well, I feel like we put it someplace close, like the Omni, the Residence Inn at the top of the hill.
Yeah, one of those.
Yeah, yeah.
Everybody seems to like the Residence Inn, Tammy. It's nicer now.
Yeah, I haven't stayed in Omni in forever, if ever, but the Residence Inn was nice when I stayed there with that.
Yeah.
Years ago.
So one night
Yeah, for Friday.
for Friday night.
Yeah, Friday night.
Thursday.
Thursday night.
Checking in on the 27th and checking out on the 28th.
Go on ahead and pay for it.
Yeah, I mean, yeah, I guess. We want to pay for it. We don't want him to have to pay for it and get reimbursed.
Yeah.
If something happens and he doesn't come, that's the only. Chris, do you have any suggestions?
Well, we didn't know 24 hours before it should be able to cancel.
Yeah.
Like we do it.
Somebody else will just have a night.
Can I do that through, do I call the place or can I do that for like 4 minutes or something?
Okay, it's a state rate also.
State rate?
Yes, it's a government rate.
I think she's a good human being, but it'll be interesting. Yes.
Stephanie sent us a thing that says, please reply to all and attach the edits before the legal order to be accepted in your class.
Okay.
Do you want me to send that on the thing too, or I
So Misty, when does Khaki come back?
I mean, not right now.
She comes the 28th. So she has another week after this one.
Unless she's send it right this second.
But she made it to the West Coast.
Yeah.
Yeah.
Okay.
What
And
exotic trip does she have planned? Just going up and down the West Coast?
She rented an RV and drove out there to go to Washington, I think, to visit some friends from when they lived there, to surprise them with a visit.
They live there, yeah.
Taking their time to photograph and see all the animals along the way.
She and I took a walk recently down the green belt. And, you know, I've taken that walk 1,000 times. And she spotted like turtles and lizards. It's like, I need to walk with you all the time.
She's got an eye.
Yeah. All right, are we all back? Oh, not quite. Well, I'm pleased to report that I think we'll be finishing up early. So, So in the last CPMT meeting, Lori suggested that I share some thoughts about all these years of being involved with the CSA system or the local system, and it was kind of fun going through my memory lane thing, thinking about that. But one of the things I would like to share is that even way before CSA and even what I'll share in a minute, which we affectionately call Chain, our community did a lot of work around establishing a systems of care across all of our systems. And Martha and I were chosen to go to a big conference out in Breckenridge. And this would have been in the early 90s, right, Martha? And so,
right. I think 92, maybe.
Yeah, that sounds right. And so the idea of coming together as a community across agencies, across jurisdictions, and really looking at how to develop a robust system of care for our kids and families. I mean, it goes way back. You know, we had these ideas even before the state decided to create CSA. So we've always been a front runner. And to that, and along those lines, before OCS was CSA was enacted, there was I can't remember if it was legislation or just a requirement that communities were asked to develop multidisciplinary team processes for kids in court under CHINS petitions. And so the city and Albemarle came together, as we have always tried to do, and whenever we've tried to implement some kind of process, came together and established what we affectionately called CHAIN, the Charlottesville Albemarle Interagency Network. And that entity created the process through which we conducted multidisciplinary team staffings for CHINS kids. And I was at Region 10 at the time. And that's when I began working closely with Cheryl, who was a foster care supervisor in the county then. And Martha was at the court still, or even back then. And then when CSA was enacted, it kind of morphed. We built our system on our already created chain structure, and started working together again as two localities coming together to figure out how we were going to implement our CSA program. And so way early on, I was at Region 10, and the position that we called the FAPT coordinator was actually housed at Region 10. Her name was Debbie Stone. Was she the first one, Cheryl, or was there one before that?
I think there was one before that, and then Debbie. I think that's right, but I may have it in reverse because it's a long time ago.
So who was it, Cheryl?
I remember, or maybe it was. No, you know what I'm thinking of? I think Debbie Stone was the first one. I know the other gal. We had a CSA case manager. Remember?
Yeah, I was gonna talk about.
Okay, all right, okay, that's who I was confusing that with. Yeah.
So Debbie Stone was, a Region 10 employee, and she managed our, at that point, joint FAP process. We decided to come together as having a joint CSA. But back then, we also had a position that we called the FAPT case manager. And at that point, I figured out how to fund that position by billing Medicaid for targeted case management. And so many of the kids served by the FAP system, had Medicaid. So she managed cases that didn't have a ongoing case manager, or also supplemented the case management for these kids. And so again, the theme has always been collaboration between all of our agencies. From the get-go, we've always worked together and tried to be a seamless program and system. I think there were multiple FAPs back then. Like right now, we have one FAPT. But early on, we had 4 FAPs, like one meeting every week. And so each FAP had a different group of people. And then they were populated by a mixture of city and county folks. And so, so the cases could go to one or any of the FAPs. Then at some point, it was decided that the FAP coordinator position would move to the Commission on Youth and Families, because the city and the county decided to have the Commission on Youth and Families manage our local CSA process. And if my memory serves me correctly, at that point, the commission was housed in the city. And so the Debbie Stone's position actually went over to the city, and the commission managed it there. I don't really recall the background for why the commission was then switched to the county, but at some point the commission came under the county, but the CSA still stayed under the commission. And the first director was Sapphira Baker. That's how we knew of her when Kathy got her to be the facilitator for the retreat in 2015. And then we had I think she was still called a FAP coordinator, and that was Cindy Stratton. Or maybe she was called CSA coordinator, because then we had another position that was a FAP coordinator who did the scheduling. And so all of the management of the CSA system was occurred within the commission, but there was still a CPMT, and there was still a program subcommittee, and we still had joint FAPs at that time. But I wanted to highlight some of the things that occurred during that time when coming out of program subcommittee, as well as coming out of the commission and the CPMT's joint work. So under program, there was a lot of work done to bring a day treatment program here in our area, and that's when Elk Hill came. We did a lot of work with Region 10 on creating the crisis stabilization program. And those of you who have been around a while remember that when we had kids who really needed a safe place, but we needed some time to conduct a robust clinical assessment, we contracted with the A-Home, and it was the hospital, the residential treatment center hospital that used to be in the old charter hospital building that's no longer there. Now it's just an apartment complex. I'm thinking that the program's name was Whisper Ridge. Does that sound right? Yeah. So we contracted with Whisper Ridge when a kid really needed a locked facility, and we contracted with A-Home if the kid just needed to be out of their birth home and just a safe place. And then Region 10 created a really robust assessment process that took 45, 60 days, I can't remember. And that was a really exciting time, because it didn't always keep kids from coming into care, but it certainly helped us to give time to create a more thoughtful plan that would meet the child and family's interests. And then some of the other programs that came out of program subcommittee is there was an independent living work group that looked at trying to enhance services for our older youth. There was the family engagement work group. And then also during this time, the commission and CPMT pulled together a task force, and they called it the Children Needing Extensive Services. And there was a lot of work done on how can we keep these kids that are so troubled and had such high needs from being shipped off to residential or coming into foster care. And I can't really recall specific initiatives that came out of that work group, but when we were talking about data collection, I think that's a good example of a time when we as a community looked at the data about what was going on with these kids and their outcomes, and we tried to figure out an action on how can we help these kids in a different way. So then at some point, I think in around 2009, somewhere around there, it was right after the recession, and the county decided to no longer fund the commission. And so both DSSs were asked to take on CSA. And that's when CSA came under the respective DSS, and we hired well, we didn't hire a CSA coordinator at that point. We gave that job to an existing foster care supervisor here in the county. I can't remember what the city did. What did the city do when DSS took over CSA?
That's a good question. It's
like I've been here since.
Katie's been here since then. I mean, so Katie's position was formed, that we just did different things. Because Katie, you were a foster care worker at that time, right? Yeah. And then they created that position, and then we rearranged our child welfare to pull that in.
And what I couldn't remember is, was that the time when then we went to separate FAPs?
Yes, because at the time when that all happened, the Board of Supervisors and City Council determined it was going to be jointly kind of, the two groups would meet jointly, but they would be separate jurisdictionally, and the budgets would be different, would be separate.
Okay. So then we went to, one of the things I forgot to say is during the time when we had joint FAPs, but several FAPs, like one a week, I remember every 5th Friday, we had a 9 to 12 all FAPs meeting, and we brought everybody together. And that was a way that we tried to make sure that things were consistent and streamlined between all of the different FAPs.
And that's also the time when case managers, when that FAP was made up of staff level, because we had another tier called the Case Authorization and Review Team who did the actual funding authorization. So that's why we were able to pull in. And actually our health department partners were on those teams, which was wonderful at the time.
That's right. The health department has never been on our FAP, but
they were back then.
Oh,
they were initially.
Oh, okay, that's right.
That's why I said it was really great. We had the public health nurses on our FAPs originally, and then they just felt like they couldn't do it after a while.
So I'm really glad you were on this meeting too. You're filling in the gap. And so since then, the CSA has been in DSS, and even though the CPMTs are separate, obviously we continue to meet jointly because of the commitment to the collaboration. I wanted to also highlight how our two jurisdictions and our two communities continue to come together whenever it's appropriate in terms of we're trying to implement something. So when the new CHINS service type came into being, and there was the possibility of parents being able to place their children underneath the CHINS process, Region 10 came to the table and were willing to partner with us to establish a process by which they would case manage these kids, either receiving services on a prevention side or residential. When we wanted to implement a more robust UR process, Region 10 again stepped up to the table. Early on, when CSA first started, the community was committed to the court service unit continuing to have a funding stream for their kids. So both localities created the non-mandated fund and dedicated that to the court service unit. So since the early 90s, there's just been this very clear commitment to collaborating and trying not to work in silos, and really, in as much as we can, to network across our programs and systems. There's always been difficulty because different regulations and confidentiality restrictions, but I think this community has done an amazing job of really working that. The other thing that we've been really fortunate at is from the beginning, the powers that be and continue to set it up so that we always got blessing from the state to allow our FACT to make approved services and approve the funding. Now, ultimately, obviously, the CPMT approves it, but when a case manager leaves the FAP staffing, he or she knows whether they've gotten the approval for the funding. And those of you who have interaction with other localities know that that's not always the case, and it really severely delays service implementation. And also, frankly, like when I was a supervisor, I felt very capable of making good recommendations for services. As director, not so much, because I'm too far removed. And so I think it's totally appropriate for the decision-making to be at that level. And I think it's to just all of our credit that we continue to advocate with OCS to show that we have a child-specific team process, and we build on that so that the FAP can have the expertise and the authority to make those decisions. Another initiative that came down was that IACT process, and again, Region 10 was very instrumental in stepping up and helping us with that. We've always been really lucky to have community attention as our partner. They've been in this process from the get-go. There's always been a community attention representative on CPMT, and community attention has altered its services, given feedback from CPMT and program. Like I said, when the crisis stabilization program was started, community attention was willing to offer the A-home. So it's been wonderful to experience the cooperation and collaboration. Let's see. That's really what I wanted to highlight. We've certainly gone through a lot of changes, but when I really think back on when we started, there's a lot that's the same, and that's the dedication. I was talking to Kevin Kirst about something else, and we were talking about my retirement, and he and I were just sharing stories about the collaboration between the DSS and the special education, and how we worked together really closely, when he was just a special ed coordinator in this process. We've always tried to make it as easy as possible for case managers. I was on the work group that created the IFSPs and what do you call those things? Addendums and whatever. I can't remember what they're called anymore. But there was a concerted effort to try to make it as easy as possible for case managers. And then the last thing I'll say is there's always been a focus on making the FAP process as family friendly as possible. I remember distinctly there came a time when we all decided we had to stop bringing our laptops to the FAP staffing, because literally the table was set, like we were all sitting on one side of the table with our laptops in front of us, and the family was across from us. And it's like, no, that we're done with that. And then I remember working really hard as FAP chair to find ways to make it really comfortable and as much as possible at ease for the families. We used our parent rep to try to help with that process. I remember when I was FAP chair, the parent rep would go out and talk with the families and kind of bring them in to provide support, and would often sit next to them to try to make it easier. And so I'll end with a testimonial about that. About a year ago, I would happen to run into a parent whose child had to be staffed at the in the FAP, and I was very embarrassed because I don't remember. I mean, we saw a lot of families, but she talked about how grateful she was for feeling accepted and welcomed, and as much as she could feel at ease in the process. So something we did worked, and I think that's continuing given the feedback that we hear from families. So this has been a highlight of my career. I really believe in the collaboration. I believe in the whole model of systems of care. I believe in serving kids in their locality, in their homes. And despite all the challenges and the politics, I remember when Susie, what's her name, was OCS director. I call that the reign of terror. She ruled with a heavy hand. But even during that time, I think I'm very proud of our community, how we always tried to rise above the rules and regulations and try to do what was best for kids and families. So that's my trip down memory lane. Thank you, Cheryl, and Katie for filling in the gaps. And Martha. That's all I have to say.
So Phyllis, thank you. And I know I initiated this, but thinking about your retirement and thinking about the future, and I heard a lot of things going through all the things that you said over the years, leaving a group of people to carry something forward. Is there anything like this you want to just emphasize as never forget this, or always? Is there any like moment of just saying, okay, now moving it forward? What would you tell us?
I think relationships are key. When I think back on all the years, it's the relationships that allowed us to work together. I mentioned my relationship with Kevin Kurst. That's how we were able to find the right things to do for our kids. In that case, it was kids in foster care that were also special ed. But our relationships with our Region 10 partners, with Martha and the Court Service Unit, the relationships between DSS, if you stay in relationship, then you have a basis on which to hash things out. I hear about localities where there's real turf wars, and I just don't. I think that obviously on any given day we might feel like somebody's dumping on us, but that's not been a theme in this locality. And I think the way we've worked around that is because I think there's genuine regard and care and respect and credibility, and we are committed to maintaining those relationships. That's my view. Oh, I didn't know this was going to get touchy-feely.
Hi, it's Nita. Can y'all hear me?
Yeah.
Yes.
Yeah.
I just want to just thank you, Phyllis, for your collaboration and being a leader in all that throughout the process. I go to meetings with other CSBs in our region and outside of our region, and for the last 10 years their issues, they are either staying very cleanly in their lanes, and so they don't have the services that our community has. And so I've really appreciated the collaboration and your leadership and relationship, and we'll very much miss you. Although I have, of course, high hopes for, those that are left behind. We'll do okay. But I think intensive care coordination is an example of that. Our community really has a viable, useful, helpful, high fidelity wraparound intensive care coordination service. And that's actually relatively unique. And I don't think that's because of Region 10. I think that's because of the relationships with the partner agencies through CSA. So we'll miss you, Phyllis. Thank you.
Thank you for bringing that up. That was an important, the intensive care coordination. That was huge. And that's the other thing that I think we really excelled at. When we see an opportunity, we go after it. You know, and it's not just that we take this new regulation and just, you know, we go after it and try to make it into something that really makes sense and is quality and meets is in the best interest of the kid and their family.
Phyllis, when you talked about the commission, one of the things that I think is important to mention, there was a study about overrepresentation of children of color done before the commission kind of dissolved. And I think that probably led to the work that City Council directed us to do from like 2012 to 17, which has now led to the Georgetown work. So really all that goes back to that interagency, the work that happened, you know, like 8 or 10 years ago, which is really, really speaks well for us, I think.
Oh, thank you, Martha. That's I'm reading the chat. Oh, thank you. Well, I'm not gone yet. I'm here next month. This isn't a goodbye. I'm just giving you the memory lane speech.
Well, that's good because I've got a list of like 25 questions to get at you before you take off. So thank you, Phyllis. I've always appreciated your leadership and I'm sorry to see you go.
I'm happy to hear the 25 questions. Well, I think that's a wrap for this afternoon. I think we've got a great plan, and we'll try to kind of shape it into something that is manageable and makes sense. But I'm excited about just kind of the focus on looking at some specific things and coming up with some action items for those. You have an hour and a half extra. Go out and take a walk. All right, bye y'all. See you next month.
Bye, everybody.
So long, bye.